I wish I started that sooner for my office. And, we have sponsors that do that. And some dentists say, I'm going to do it myself. I'm going to keep a spreadsheet about to keep track. And the DIYs have a lot of risk. So if a dentist was watching, a tough dentist, which is like me, and says, I don't want to use a patient financing company. I don't want to give up like 5, 8, 11, whatever, it's 12% of my fee. I'm just going to have the patients do in-house payment plans. Where can that go wrong, right? I'll share. It's gone wrong for us numerous times. So I'll say, where can that go wrong for an office who says, I want to DIY my own patient financing?
Yeah, this is like my all-time favorite question, Paul. So I've experienced that as well, right? Seeing patients that just default and no longer pay it, and they say that they will, so you're chasing them. Also, you have to think about the insane amount of time that your staff is putting into collecting the credit card information, to making sure that they're running that on time every month, chasing the patients because the patients aren't paying, or they close that credit card down. So now they're chasing them for a new credit card. So just so much time that you're paying your employees to chase these patients down. When it comes to paying that percentage for someone like Cherry, right? You're paying that merchant fee with Cherry. It's really, you're paying for the simplicity. You're paying for the time that you're not paying your staff to do the extra work, and you're paying for a guarantee of payment. You get paid in full within 2 to 3 business days with Cherry, and there's no risk. If the patient defaults with Cherry, that's between the patient and Cherry. We will never.
That's what I love. I love the nice things that you said, but I'm a parent of a 9 and a 5-year-old, and good parenting is all about bribes and threats. Bribes and threats. If you're good, we're going to get ice cream, and if you're not good, we're never getting ice cream for the rest of our rest of the year. So I always share with my team, the patient financing companies, and I happen to be talking with our awesome sponsor, Cherry. You literally do this every day. It is your expertise. You have the ability to create a relationship with that patient that's different than the dental office. And I will share, over my 20-year career, patients who don't pay you and trying to get them to pay you, it just can ruin a relationship. And it's difficult. And we just do not have the bribes and threats tools. We don't have the bandwidth. We don't have the verbiage. And it's great to outsource this to Cherry, to let them, like you just said, you get paid and the rest of it is between Cherry. And, just as I'm a practice owner of multiple practices, we're already, patients use credit cards. We're very familiar with the credit card. This is like a supersized version of the credit card process, where many, just as I kind of teach our audience, not all patients have a $30,000 limit on their credit card. Also, it might not be financially wise to put something on your credit card for 12 months for $30,000. So you guys swoop in as really the heroes. I mean, I say this with true authenticity. You allow people to get the care that they need to chew and smile.